So has it worked? Well, the Welsh Audit Office states that yes, there is some form of nutritional screening within the hospitals in Wales. However, from examining patient case notes, they found that 1 in 10 patients received no nutritional screening whatsoever. In relation to the All Wales food chart, it was found that they were often not completed, and if they were, the quality of information was not up to standard. They also found that filling in these food charts actually got worse throughout the day, and that quite often at the end of the shift, nurses would actually ask patients to recall themselves what they'd actually eaten and drank that day. The Welsh Audit Office have made a recommendation stating that there needs to be a more comprehensive and consistent approach in monitoring food and beverage intake in order to provide patients with a better plan of care. In my eyes, I feel that prevention is better than a cure in regards to malnutrition. As a student, whilst on the wards, I knew exactly where the food charts were kept. I knew which drawer they were in. What I could not understand, and which raised a burning question in me, was why was it always left so long before they were implemented? Why were they not part of a patient assessment right from admission? For example, a patient who will call Mrs. Jones had been refusing all her meals, and I raised a concern, and I was told, well, of course she's not going to be hungry and she's not going to eat because she's feeling sick. But don't worry, because she's having an antiemetic, and as soon as that's working, she'll start eating again and everything will be fine. To which my reply was, well, everything won't be fine if she actually suffers from malnutrition. So then I actually went and placed Mrs. Jones on a food chart and referred her to the dietitian. And why I did this was because I simply took the time and I talked to Mrs. Jones. I asked her questions about her general appetite, into which she stated was usually fine. And then she said, but. I then found that she'd been eating very little for the prior 2 weeks before admission. This meant that for 3 weeks, Mrs. Jones' nutritional status was changing and was getting worse, which would hamper the healing process of her illness, and it would actually cause her more distress and harm. I am not inventing a change to initiate into practice. I want to implement a change to practice with a tool that is already in place. My aim is simple. It's to reduce the number of patients within the hospital setting becoming malnourished simply by changing the way a nutritional monitoring tool is used. I have to say, with who will benefit, that I hope, and at foremost in my mind, it will actually be the patients. So the benefits from implementing this change is that there'd be a prevention of malnutrition of patients admitted to hospital. Nutritional status of patients highlighted, which will then mean that a plan of care can be put in place to address the patient's nutritional needs. It will also ensure prompt referrals to a dietitian, which allows for specialist input for the patient. And it will also benefit the healing process, which could mean a shorter stay for that patient within hospital. It will also prevent a failed discharge. If a patient goes home and is malnourished, then the effects of that malnourishment can mean that that patient will again become ill and will then bounce back into hospital. And also the cost, because the longer a patient is admitted to hospital, the greater the cost for the NHS.